here is a general question about determining which type of stakeholders should be involved in committees. This is from Paul Blasey. How do you decide on the percent of each type of stakeholders involved in your committees? Like it looked like from some of the graphics, it was just one patient or 10% of patients. Or was there a guide on this, or is there some best practice way of working out? So can you comment on the composition of stakeholder engagement when you have stakeholders from different groups? And that can go to any one of you.
I mean, I can just take it for a little bit. At a minimum, you want whoever's touching the process, right? So I think that we have our end user, right, of our patient or whoever that is. They must be there, right? But as every individual from a process perspective, you want to have them all at the table. When there was a literal table, then you had capacity constraints, right? I think those constraints still do exist when you have an environment like this. If we were to have a rich discussion with the number of people that are in this room, we have 42 people, I think, that'd be pretty hard, right? Unless we're really thoughtful about employing breakout sessions, and it would still be hard to really build trust in the room. Building trust, I think you heard from all of us, is essential. And so I think that would sort of cap a capacity constraint on that, even in an online environment like this. One really
would others like to comment on that? How do you decide on the composition and the proportions of your advisory and other groups?
That's a great point. I can add in some of our decisions had to do with our goal was to have, just like Dr. Pinto talked about, every stakeholder that was related to the interventions we were delivering. So we needed a speech therapist represented, we needed an OT, we needed nursing, we needed social work. So while in that distribution that Dr. Martinez presented, it does look provider heavy, it was the complexity of the questions we were asking. So it was really, there was representation of one stakeholder for all the different groups. So we needed 20 different perspectives. I would have loved to have had more patient advocates and caregivers, but as Dr. Pinto said, you get too much bigger and it defeats the purpose.
Here's a question from Rachel Przinski. I'm curious about the role of staff turnover in patient engagement. Since we know there's a serious issue with turnover in nursing homes, but I think actually this can apply to both projects. When looking for committee members, did you consider tenure at the institution or include requirements within your charter to reduce attrition? Or alternately, do you feel like participation helped mitigate turnover in some of these organizations?
I can start with that. So I think part of in our study, what was really helpful was that collaborative charter development, which helped us jointly establish what participation expectations were and hear from the advisory committee what was the amount of time, for example, that they had available, scheduling for meetings, et cetera. We've also been able to actually retain most, if not all, of our advisory committee throughout our multi-years in this study. Recently, I'll give you an example of someone who did lose their job as part of the nursing home kind of change, but this wasn't tied to his participation. And so we had a really nice discussion about really the value of this person's contribution to our advisory committee and reaffirming our commitment to really continuing to support him and include him in this, and that he was part of this advisory committee. And so that continues to support our collaboration too.
So that was a question about planning for staff attrition or choosing members who might stay through the length of the project. There's a question from Ken Harwood that's about addressing the issue of onboarding new stakeholders when you have an existing stakeholder group. He says, we have struggled with this in the past, especially after there was an established group dynamic. Do you have experience with onboarding new members?
Yeah, I mean, we did. We were fortunate to have a COVID-19 enhancement so that our stakeholder partners came together We co-wrote the grant for our stakeholder COVID-19 enhancement award. And the award specifically was to expand the panel. So the thing that the panel sought to expand, right? So this was, we addressed the wishes of the panel. They wanted to partner with smaller and medium-sized organizations. They had a wish to expand to different business sectors. And so, so it was an expectation, and we just, the challenge was in part doing, how do we scope and manage recruitment? Because the Near West Side Partners had such a great reputation, a lot of people wanted to join, and then we got to that panel expansion that we had to control. So we had a good problem to solve there. Sorry, Ken.
Natalie or Jenny, did you have experience with onboarding any new stakeholders?
Jenny, do you want to take that, or?
Sure. Yes, absolutely. Even early on in the study, for example, we had a stakeholder who, due to time constraints and just the changes in their personal life, wasn't able to continue, and we onboarded a new member. Part of our approach has been continuing to reinforce the value that all the stakeholder perspectives have. And so if we don't have one of those perspectives or many of them, that does also affect our really ability to consider and integrate all of these different perspectives in our research question. Our charter and our procedures are also such that because of that, those collaboratively developed guidelines, that's helped us establish a clear path for being able to support new members, but also make sure that everyone's on board in terms of what happens when new members come in, which has been really supportive for us.
Here's a question for Daniel Pinto from Samanaz Koja. Thank you for a very interesting presentation. I wanted to know, since the PCORI project is more about capacity building for future studies, how are you planning to assess the success of your capacity building project? Is there a plan to monitor future studies that result as a part of the Corporate Health Research Partnership?
Absolutely. And thank you for that, because I didn't quite get to that in my slides. So in part, our success was because our work resonated so much with our partner organizations. The Near West Side Partners reimagined their vision and their role in the community, and specifically added a healthy community working team. So we were sort of this ancillary kind of project that they took a risk on, because we were actually sort of mission adjacent. And that's always a risky thing to do for an organization. So I am forever grateful that they took their chance on us. And then we actually just became mission aligned as they changed their mission. So our sustainability now is really good. We are accountable to a working group that is then accountable to the board of the steering committee of the Near West Side Partners. We absolutely are generating studies right now. We have a feasibility study that is under development and design, and it's all about being able to be scalable and implemented, because these organizations are global in their scope. And so we need to be able to help them to deliver health and wellness at a very scalable way.
Thank you. And I think we'll have time for one more question. And here's a question from Paul Blasey. Just wondered whether the panelists had integrated virtual platforms to facilitate stakeholder engagement in meaningful ways where everyone can't fit around the table, and if they have any advice on best platforms. And I would echo this question. We'll have to have a quick answer, but I'm involved in a stakeholder group now during this COVID period using WebEx, and there's so many technical difficulties. But if folks could talk about virtual platforms and their experience and advice.
For us, it was a relatively easy move because all of our corporate partners had already done something like that. So because of COVID, it was just how they were communicating and contacting. And so we just had to choose one that, and so we chose Zoom, and more, the greater problem was probably user error on our team's part in terms of really being thoughtful about, just the upfront cost of understanding those systems. It's a lot of it. It's not trivial.
On our end, we've been very successful with Zoom and Basecamp as a project management platform. Part of a couple of things that have helped us have also been continuing to educate ourselves, but also reach out to our advisory committee and respond to any concerns that they might have about using the technology, which has been helpful, and also considering access to, for example, internet services or devices to do this as well.